My name's Massie. I'm from Worthington, Kentucky. I had bilateral hip replacement. I was in pretty bad shape. I could barely walk. It had been getting progressively worse over a 6-month period. It just kind of really started all happening at once. And I'd been speaking with my wife about this, and we had come to the conclusion that I was going to have hip replacement surgery. And we did some research on it and found out that Dr. Trinidad did the anterior approach to it, and that he's very successful at it. So I went ahead and came down, had a visit with him, and he told me that my hip was the worst hip he'd ever seen in his career, and that's pretty bad. So he said, you know, your other hip's pretty bad too. So we went ahead and did the bilateral, and I'm good.
To do both hips at the same time is unique just from a positioning standpoint, and our ability to do the hips anteriorly or through the front using our special table called the Hannah table allows us to go from one hip, finish the one hip, and do the other side without repositioning of the patient.
When I found out about the recovery time for the anterior approach, it was a matter of weeks versus months. And you know, I work for a living, so I had to get it done.
Mr. Massie was a guy that's very active. He wanted to get back as soon as possible. It takes a special kind of person to do that, and he was a great candidate for this. You know, his motivation and his drive to get better with both hips.
I walked out of here 2 days after the surgery. By the 7th day, I was working in my garden, and by the 16th day, I was crawling in a boiler in Chicago, Illinois, back to work. It's the best decision for my physical well-being that I've ever made, because I was in pain way too long, and even Dr. Trinidad told me, he said, I don't even know how you were walking.
For the patient, the advantages are the fact that there is no restrictions. You know, with the more traditional posterior approach, you worry about the patient bending at the hip, just sitting in a chair, sitting in a car seat, you worry about the hip possibly dislocating. When we go through the front of the hip, we're not detaching any muscle, tendon, ligaments. We're leaving all the anatomy intact, so there's that inherent stability. So we have no restrictions after hip replacement surgery when we go through the front of the hip.
Dr. Trinidad, when I came back to see him, I'm sure it was 3 days after the surgery, I walked in and he said, man, you look good. I said, you want to dance?